Sorry. Good evening, everyone. So, in the next 6 minutes, 8 minutes actually, we should get started. So, how we doing? How is your day been? How's been your day? How is everything going? And how are you preparing for the Christmas? What are you doing for Christmas? Are you traveling? Are you, what are you doing literally? Mm, Interesting. Getting started. Oh, thank you so much. Kudos to you for all the amazing work. Oh, well done. Thank you. Thank you. Value monetization. Thank you so much. I really appreciate that. And I hope you're looking forward to this live section. In the next 4 minutes, we should get started. I hope you can see me value monetization. Can you see me really clearly? If you can see me, put it in the live section. If you can hear me, put it in the live session. And if you're looking forward to this live session, say yes in the live session. all about contraception. All about contraception. That's all we're going to be talking about today. Everything about contraception. I am so excited about tonight's live. I am so looking forward to it. All about contraception. I trust that it's going to be very impactful and we are gonna gain a lot of knowledge today. Oh yes, I can see you very well and hear your voice. Thank you so much. Yes, once it's 9 o'clock, we'll get started. Mm, okay. This is sleepy. Can I get there? Oh, here she is. Good evening. Okay, so I think we should get started now. Mm, with this cough. Yes, it's 9 o'clock. It's 9 o'clock UK time. It's nine at the dot. So we're going to get started right on the way. So good evening once again. Good evening, good afternoon, good morning, wherever you're joining me from. My name is Dumebi. I'm a UK-based parenting expert, and I work with parents across the globe. And I'm a mother of two. I'm also a breast milk and breastfeeding advocate and advocate for children's well-being and development. Just helping parents know how to create childhood memories for children, helping parents to understand their children's stages of development, knowing what to expect, what to look out for, and everything that has to do with raising a child up from zero till they turn 18. And also, so today we're going to be looking at this is actually my second live, and today we're going to be looking at. I hope you can hear me. I hope you can see me. We're going to be looking at all about contraception. We're going to be looking at what is contraception, how does it work? What are the types of contraception? Because a lot of women they get confused, they get worried. Some will say, contraception. What is contraception? How does it work? What are the types of contraception? Sometimes I hear pills, sometimes I hear calls. What is the difference? And when should you take it? If I'm on pills or I'm on calls, am I not going to put on weight? Or some will say, oh no, I don't want any of those because of fear of putting on weight, all of this and many more that we're going to be talking about today. And I trust that our guest speaker, will help us, she will explain it in such a way that we will understand, and she will really help us understand the differences in all of this and help us, make right decisions for ourselves in order for us to prevent unwanted pregnancies or unplanned pregnancies and have, enjoy intimacy with our husbands and our partners. So I trust that this live session is going to be very, very impactful. So before we start, I would like us to, to have an idea of who our guest speaker is. And so let's go. Yeah. So our guest speaker is called Dr. Egbe Efe Efefaruru. Dr. Egbe is a general practitioner in the UK with diplomas in sexual and reproductive health at the Royal College of Obstetricians and Gynecologists, Dr. Egbe also has competencies in coils and implant insertion and removal. Dr. Egbe is very keen to see women empowered to make the contraceptive choices that suit them. Dr. Egbe believes that this will allow married women to enjoy intimacy. Did you hear that? Intimacy with their spouse without the fear of pregnancy. Dr. Ebe believes that this will prevent unwanted pregnancies and allow couples to space their children and only have the children they can cater for. Dr. Egbe is very passionate about debunking the myth and anxieties around contraceptive use. So that is who she is, and I'm going to bring her on board in a moment. And before that, please, I would like you to help me make welcome our guest speaker, Dr. Egbe. Yeah, at the stage. Yay, here she is. Hello, good evening, Dr. Egbe. Good to see you. Good to see you here and good to have you here. I hope you can hear us. Yeah, you're still muted.
Sorry, I'm having some trouble with my device. I'm not sure if you can see and hear me okay.
I can see you very clearly though, but I'm hearing some sound at the background.
Okay, that's fine.
Hmm.
Sorry about that. Is it slightly better?
Yeah, it stopped now. Yeah, it
Okay,
stopped now. Oh,
that's fine. Right, thank you so much, Dumebi. Thank you for having me on
you're
this.
very welcome.
Thank you very
You're
much.
very welcome. And thank you so much for agreeing to do this with us, to share your knowledge, to create this awareness, to let us know what is going on, thank you for coming to teach us everything about contraception and contraceptive and everything. So we're really grateful to have you here.
Thank you. So,
Yes.
as Dumebi said, I'm a GP in England.
Yeah,
I
we're
just
still hearing the sound. It's not very clear.
okay. Did any
It's just making like this, and then it stopped now. Yeah, it stopped now.
is it there now? Is
Oh,
it
it started again now. Okay, yeah, it stopped now. Yes.
why it's doing that? Do you want me to leave and join again?
Okay, maybe let's see if it will work better.
Okay.
Yeah, there's a bit of network. I don't know if it's network glitch, but she's going to join us in a minute. So, yes, she's a GP practitioner. She's a professional in this field. So, she's really going to help us understand everything about contraception. What is contraception? You know, and the thing why I chose this topic is because of my experiences with women, mothers everywhere. Sometimes you see pregnant mothers, women very, very sad, instead of them feeling very happy. And by the time you get to know why they are sad, you understand that it is because the pregnancy was not planned. The pregnancy came as a surprise to them. And because of that, they are not happy. Probably they've had the number of children they wanted, or maybe there's no space between. They needed to give a gap between the child and the one they had. So because of all of this, it makes them really feel, worried, sad, and all of that. And the truth is, this is not what we want, because these children that we bring to this world, they don't ask to be born. They are innocent children. They don't ask to be born. So we're supposed to look forward to, having these children. We're supposed to be excited having them, not being sad. And that is why she's going to help us understand what contraception is and how we can make the right choices and decisions for ourselves in order for us to avoid all of these, should I call it mistakes or that we make, especially mothers, all of these mistakes, how to prevent, wanting pregnancies, how to make the right choices for ourselves, what to look out for, what not to look out for, what to know, what works for you, and also help us to debunk the should I say, the misconception around, around this fear of, I don't want to put on weight, I don't want to put on weight. My friend had, is on contraception or contraceptive, and she's put on weight and all of that. She's going to tell us all about it, how it works, and how, what to look out for and everything. So I personally, I am looking forward to this live session. So I hope she's going to join us soon. Just give me a minute. Let me see what's going on with her. Don't panic. Don't panic, because she's going to join us. Yes, she's coming. Yes, she is. Yeah. Yes, I'm going to bring her on board now.
I'm sorry
Yes,
about that.
she's back. It's okay. It's not your fault.
Hi.
It's
Oh
fine.
gosh, so
Oh, yeah,
sorry
this is so
everyone.
clear. This is so clear.
Is this better?
Yes, much,
Okay.
much better. Yeah, thank
I'm
God for
really
that.
sorry about that. Can you see me
It's fine.
okay?
Yes, we can see you. I can see you very
Okay.
clearly. Yeah,
Okay, that's fine. Thank you again, Dumebi, for having me, and thanks a lot for your patience.
you're highly
So I'm Dr.
welcome.
Egbefe Ferroro. I'm a GP in England. And as Dumebi said earlier, I'm quite interested in sexual and reproductive health and also women's health. So I have some extra competencies as a GP, and I'm able to fit coils and implants. And I'm quite happy about that, purely because, as Jumebi said earlier, I believe that people should have the children that they want. And it really
Mhm.
bothers me that there are some married people that cannot enjoy sexual intimacy because of the fear of pregnancy. So I'm happy to answer questions and share a bit of what I know, and also learn from you. So feel free to put your comments in there. I might learn a thing or two. So yes, I'm happy to be here. Thank you.
Thank you so much. Thank you so much for agreeing to do this. So we are all looking forward and excited about it. Oh, she's coming there. Where is she? Yes.
Sorry, can you see me?
Yes, I can see you and I can hear you
Okay.
too.
Okay,
Mm,
that's fine. I won't touch the device again.
I think so.
Sorry, feel free to yeah, I'll let you lead. I think we should do it more of a Q&A, and then that would kind of lead us, because I was going to share some slides, but I think the device
Yeah,
is
with
not
your device.
technology is not playing ball. So that's what I was trying to do. I wanted to try and share some slides. I don't know whether I should try again, or I'm not sure what you think.
Or I don't know. Should we try it for a few minutes and see if it doesn't, and then we just go with the flow?
Yes, okay, that's
Yeah.
fine. I'm going to try and, can you hear me?
Yes, I can.
Okay, but you can't see me, right?
No.
Okay, no worries. So I think it doesn't let me do two things at the same time. That's why I was trying to use another thing that will allow me on two windows at once. But if it's not going to let me do that, I'm going to still try and see whether I can share. So I've got my PowerPoint here. Hopefully there should be a way for me to share my screen, and then everybody can see what I'm talking about. Duh, 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 duh. If it doesn't work, then we'll just do it as Q&A, okay?
Okay, that's fine.
Okay. Right. So I think this is supposed to allow me present. Oh, hello.
Mm.
Can you hear me?
Yes.
But is there a way for me to share? If I can't share my screen, then we'll just do Q&A, okay?
Oh, okay. Or
Can you still
if he's
hear
not
me?
letting you, yeah, I can hear you. If he's not letting you, however, maybe you give us like a little intro of maybe of what contraception is, and then we can start with the Q&A because of time. Because we have like 40
Okay.
minutes gone already. Yeah.
Yeah, that's fine. So, can you see me?
No, I can't see you anymore.
Oh, I'm not sure what's happened now. Okay, you know what? Let's start with questions. So start with the questions and then we'll take it from there.
Okay. Okay. So we have some questions. Or should I, since I can't, should I take you off and then bring you back so we can see your face then?
Okay, you can try that.
Hmm. Stage. Hello?
Hello, I'm here. Can you hear me?
Yes, I still can't see. Do you want to take yourself off and then come back again and let's see if it's gonna work?
Okay.
Yeah, thank you. Okay. I really don't know what's going on today, guys, but we'll get there. Mm, okay. Hmm. What's going on today? Yes, yes, she is. I hope it's there. Yes,
You can see
yes,
me.
yes, we can see
Okay,
you.
I've just sent you my PowerPoint. If you're able to share it, please do. If you are not, then let me try and talk through it whilst Dumebi tries to see if she can work her magic so that you guys can see the slide.
I
If
think
you
let's don't
can.
worry about, yeah, let's don't worry about it again because we're already 17 minutes
Okay.
past. Yes, because of time.
Okay, right. So just
Mm,
as a general intro, there are different
mm,
methods of contraception, okay? The way I've categorized it is we've got the natural methods, we've got the barrier methods, we've got the permanent methods, we've got hormonal methods, non-hormonal methods, and we've got emergency contraception. So the natural methods, there are two main types. So you've got fertility awareness method and withdrawal method, which we call coitus interruptus. That's interrupting coitus or intercourse.
Mm.
And
Mm.
then in terms of the fertility awareness methods, you're talking about basal, using, some people use their basal body temperature, and that's kind of, they're able to tell by their body temperature when they are ovulating, and so when they are fertile, and so when they should have intercourse. Some people monitor their cervical secretions, and when there's an increase in secretion, that tends to signal ovulation. Some people use their cervical changes. So a high and soft cervix means that they are fertile. Some people use their menstrual cycle to just estimate their fertile days. And lactational amenorrhea is when a woman has just given birth and she's exclusively breastfeeding. No, nothing else at all is being given to the
Mm.
baby, just breast milk.
Mm.
And the baby is less than 6 months and she has no yet started periods. If all those are met, then it's quite a good form of contraception. So in the first 6 months, but in terms of overall effectiveness, the natural methods are they are not as reliable. So some women use them really well and they are up to 80% reliable. But
Mm.
if they make a mistake, so sometimes they think the fertile window is just, around their ovulation, maybe 4 days or something like that. But
Mm.
they may be fertile up to 7 days or 8 days. And in any
Without them
case,
knowing, yeah.
without them knowing. And in any case, sperm can stay in the vagina up to 7 days alive.
Wow.
So if they start have sex like 5 days before the
Mm.
ovulation, they may have been in the safe period at that time, but the sperm can wait patiently around till their till the eggs come out.
Patiently.
So it can be quite unreliable. But
Mm.
again, some women have done this for years and years, and there are women who tell me that they've actually never taken any form of contraception, and they're absolutely they've been able to space their children. So that's, there are people that use those methods. Then you've got your barrier methods. The most common one that we know is the male condom. Then you've also
Mm.
got the female condom, which is also a barrier to ejaculate and any secretions. You've got diaphragms and caps that people can use to cover their cervix, and this is often used with spermicides. And the good thing about condoms is that apart from stopping pregnancy, they also reduce the risk of STIs. So
Mm.
condoms are actually the only way to prevent STIs if someone is having sex, really. But the issues with condoms are that they can slip, they can break, it may reduce sensation. Some people have latex allergies, so it may not actually suit them. And they need placing every time. The diaphragms and caps, you need to use spermicide. That can cause irritation for some people, and they are less effective if than some other methods if not used perfectly. So people can
Mm.
have split condoms or burst condoms, or yeah, they can have accidents with their condoms. Some people though are quite they use it reliably and they're able to prevent pregnancy. Again, this method is not we don't usually advise it because it has a high failure rate as well. So it may
Mm.
be like,
Hi.
yeah,
Wow.
up to 80-90% effective. If you think about it, how many married people will remember a condom every single time? It's,
Mm.
like they are married, so the one day they will not use a condom, they'll be like, okay, don't worry, it's fine, because it's not like a random person, and it's
Mm.
a bit fiddly. You have to stop, you have to look for it, you have to put it on, and all those kind of things. So if they
Especially if
don't,
it's the unplanned emergency one.
exactly, so that
Yeah.
people can make mistakes. That's why people
Mm.
often come to the clinic requesting emergency contraception, which really should just be like a backup, not the everyday thing, way of preventing pregnancy. Then in terms of the permanent methods or the irreversible methods, in quotes, you have sterilization. So male sterilization, female sterilization. Male sterilization is actually more effective than female sterilization in
Mm.
preventing pregnancy. The failure rate for vasectomy, which is the male sterilization, is about 1 in 2,000. For female fertilization, is about 1 in 200. So actually, the vasectomy is 10 times more effective than a woman tying her tubes, according to the evidence. And the other thing is that with the male vasectomy, it's a day case procedure. Well, in the UK anyway, we don't put men to sleep when we do vasectomy. But for the women, most times they might need general anesthesia. So there's a risk from that, and small risk of severe complications and even death. So it's actually safer to do a vasectomy, and it's more effective. In
Mm.
terms of the risk with vasectomy, some people can have they can have infection because of the surgery. Some people can have just like something called a hematoma, which is where blood connects. Some people might have chronic pain, so like long-standing pain, and sometimes the procedure might fail. And the one thing to say is that if you're in the UK, reversal is not on the NHS. So if you change your mind and say, oh no, I've gotten with a new partner, a new wife or something, sorry, if you've had a vasectomy or tying your tubes, we can't reverse that on the NHS. You need to go for that privately. And the failure
Mm.
rate of reversal is also high. So usually we tend to do a lot of counseling when people come for these permanent methods because they can't really change their mind easily. So some people may think they've completed their family, but for whatever reason they might want to try again a couple of years later. So
Mm.
we tend to ask people what gender of children they have, how many children they have, and generally they in the UK they'll dissuade you from having it if you are very young. So if
Mm.
a 28-year-old lady comes, for instance, and says she wants her tubes tied after one child, her doctor might really try to get to the bottom of it, because if she meets someone else or if things change or she wants a baby later, then it's difficult to reverse and for it to even be effective. So for those kind of situations, we would recommend that they use the long-acting reversible rather than these irreversible methods. Not that they can't be reversed, but you can't, you can we tell them it's permanent methods, because even
Mm.
reverse it might not be successful.
Successful.
Yeah. So now moving on to the hormonal methods, which is probably where you're more interested. Um, we've got the pills, and a lot of
Mm.
people the pills are very, very common. We've got the combined pills and we've got the progesterone only pills. So two different type of pills. We've got patches, which are essentially in the UK, I think is the Evra patch that we use. So the patch that we use in the UK essentially contains the same thing as the combined pill. Then we have the ring, I think it's called the Nova ring. Again, same constituent as the combined. Combined means that it has two hormones, estrogen and progesterone, while the progesterone only pill just has progesterone. And
So is
then,
the ring same as the coil?
no.
Okay.
So then we have the long acting reversible. Long acting reversible is coil implant injection. Long acting reversible.
Long
Whilst
acting
yeah,
reversible.
so even under your hormonal, you have the ones that you just take. It is only the woman is in full control. She takes the pill as advised, or she puts the patch, or she puts the ring. But for the
Mm.
long acting reversible, you need a clinician. So for the implants, that sits in your inner arm, and the implants are 3 to 5 years. The one we use in the UK is Nexplanon, which is 3 years. um so have I got that wrong? The Nexplanon or Implanon, one of the two. We use the 3 year one in the UK. And then the coil, we've got the hormonal coil and the non-hormonal coil. The non-hormonal coil lasts for 5 to 10 years, and the
Mm.
hormonal coil lasts for 3 to 8 years. Yeah. So if I
5 to
talk you
8.
through them one after the other, sorry, what did you say?
Yeah, I'm saying the hormonal 5 to 8 years, and then the non-hormonal 3 to 5 years.
So for the coil,
Yeah.
I'll come to the coil in more detail. So
Okay.
let's talk about the pills, the combined pills. There are different ways. The combined tablets, so the pill that you take,
Mm.
that is a very good contraceptive method if people take it every single day as advised without missing any tablets. The effectiveness rate is actually over 99%. But if you use it the way most people, so typical use, the way people use it in real life, so people may miss one tablet because of something, or they may take other things that could interact, or they could have diarrhea, or they could have vomiting, or they could take it late, whatever. But typical use, you are looking at around maybe 90% effectiveness.
Yeah, which is not bad.
10% is a big risk when it comes to pregnancy, isn't it? So with the combined pill is very good for ladies that want to have a regular monthly flow, because it makes the period very predictable. So women that say, oh, my periods are all over the place, the combined pill can be good for that. The combined pill can also be very good for the skin. So for people that have very bad acne, the combined pill
Mm.
can actually help treat acne.
Oh, which is good.
Yeah. So, and it can reduce the heaviness of people's period, and it can reduce period pain. And for people that have very bad premenstrual syndrome, where they get very anxious and
Mm.
irritable before their period, and they get angry and very moody before their period, the combined pill can be used to regulate their hormones. So the combined pill has contraceptive benefits as well as non-contraceptive benefits. And if a woman is over 40 and she's on the combined pill, actually it can help with some of the menopausal symptoms as well.
Mm.
But it does have its own side effects and risks as well, though. So in terms
Mm.
of the risks with the combined pill, it can increase the risk of blood clots in the legs or lungs, which sometimes can be fatal, unfortunately. But that risk is very low in a lot of the population that take it, which is young, fit ladies. It can also increase the risk of breast cancer. So
Mm.
if people have a high risk of breast cancer, like if they're obese or they have a family history of breast cancer, then we may not prescribe this for them. So watching this video or this broadcast does not constitute medical advice. I forgot to say that disclaimer. So you can't go and buy a pill based on what you hear here. You still need to go and have an individual conversation with your GP or with your sexual health provider. Reason being that for instance, the combined pill cannot be taken by certain groups of people. It cannot be taken by people with a BMI of over 35. It cannot be taken by people that have migraines with flashing lights, because that can increase their risk of a stroke. It cannot be taken by people over 35 that smoke, or that have stopped smoking, just like, that have smoked within the last 12 months, or people with personal or family history of blood clots, breast cancer, especially if it's first degree relatives that were young, if people have liver problems. So it's not everybody that can take it.
That can
So
take it. Yeah.
yeah, so generally a lady would need her blood pressure checked, she would need her weight measured, and she would need counseling to make sure that she doesn't have any of these risk factors before she can be placed on the combined pill. So I think I've talked about most of the stuff with the combined pill. The
Mm.
progesterone pill, though, is a different kind of pill that. So the combined pill, going back to the combined pill, like
Yeah.
microgynon, is normally the way most people take it is to take 3 weeks and then have a 1 week break, 3 weeks and then have a 1 week break, 3 weeks and then have a 1 week break. So
That's a
that
tablet.
Yes. So that's the way most people take it. That's the olden days way of taking it. The newer way of taking it is actually you can take the active pills for 3 months and then have a break. Take the active pills for 3 months and then have a break, about 4 to 7 days break.
So is it just like a tablet? Like one tablet and just take it, and then the next 3 months? Oh, okay.
Every day, and then you have a
Oh,
break.
a tablet every day for 3 months. Wow.
Yes. And then
Oh.
you have a break. Or you just take a tablet every day non-stop until you have a bleed, and then you stop for about 4 days, 4 to 7 days, and start again. So the packet would usually tell you how to take it, but also your healthcare provider will tell you how to take it. So this is a very
Mm.
individualized counseling, and we work
Mm.
with the lady to see what fits her, what she wants to achieve as well.
Mm.
The second type of pill is the progesterone only pill. Progesterone only pill does not have estrogen. It only has progesterone. So it doesn't really increase the risk of breast cancer or blood clots or stroke or anything like that. And most people can take it. Most people. Very few contraindications like active cancer and stuff like that. So most people can take it. And it doesn't matter what the weight is. It doesn't matter if they smoke or they don't smoke. They can take it. And it's not the one where they take 3 weeks and have a break or 3 weeks and have a break. You just take it one tablet every single day. But you have to take it for 2 days in a row for it to become effective, unlike the other one that I mentioned earlier. Now, in
How
terms
long are
of
you going to take this one? You say you take it every day. For how long?
till you
The
want
combined one is,
till you
so you
want
just
to
take it.
cooperate. Yeah.
Really?
Yes, some people. So
That's
if
like someone living on drugs now.
yes,
No.
some people prefer that, and they've been on the pill for 10 years, 15 years. So just take one tablet
Every day.
every day.
No.
So that's why, just because of that, some people don't like to take tablets or they won't remember. That's why we talk
It's all
about
like
the
me.
same one. Yes. So the progesterone only ones are daily tablets, and they also have other benefits as well. So some people, for the progesterone only tablets, it can stop their period completely. They won't have a
That's like
period.
the side effect.
And that's a desirable side effect for some people. Some people actually want their periods to stop.
Mm.
Like if they have heavy periods. Plus, having a period doesn't really give you any benefits anyway. It's not like you gain anything by having a period.
But having a period, it shows that you are, should I say, it shows that you're fertile, isn't it? It shows that,
No.
really?
Mm-mm.
You mean having a period, like this monthly period we have, does it not show that a woman is fertile or a woman is, so why do we have it then? We're
Should I tell
debating.
you what a period is? And you must promise me that you will not laugh.
Okay, go on.
A period is the weeping of a disappointed uterus.
Mm.
Basically, every month your body prepares to have a child. And when it
Mm.
doesn't get a fertilized egg, it has to shed all that preparation in the form of a period. So your period, having a period doesn't prove anything. So if a lady is on certain forms of contraception, she will not have a period. The progesterone will just, make the lining of the womb, thin. The body will not think that it's going to have an egg and keep, layering up the uterus and preparing. So a woman might not, a lady might not actually have a period on certain
Mm.
forms of contraception. Now, for a pregnant woman, for a married woman that wants to have sex anytime, any day, that's
Mm.
fantastic because she doesn't have to ever bother about a period. Apart from that, some people's periods are heavy and they actually bleed to
Yes.
the point of becoming anemic. So you are
Yes.
saving that blood so that you don't become anemic. And there's no
Mm.
health risk to not having a period. It doesn't go
Ah,
and cause problems in the body or store in the womb or anything like that. It
I was
doesn't.
going to ask that question.
I
Because I
thought
was
you might. I've heard that question
okay,
a lot.
okay.
So there's no medical, as far as I'm aware, there's no
No
evidence of any
side effect, no nothing. Okay, as
nothing
long as it
from.
doesn't, that's fine then.
No, it just means that somebody can just live a free life and not have a period every month, especially if
Mm.
it's painful or heavy.
Mm.
Then you can do without it. So the progesterone only pill can have that. The combined pill, if you take it every day, can actually do the same thing if you take the active pills every day.
Mm.
In terms of the side effects of the progesterone only pill, some people can have acne worse. Some people can have headaches. Some people can have mood swings, breast tenderness. But again, this is not everybody. A lot of women I know on the progesterone pill are actually happy with it, and they don't. It doesn't cause them any problems. The one thing I must say though, for some people, the progesterone only pill can cause irregular periods or prolonged periods. So they can just, especially in the first 3 to 6 months. So if we start people on the pill, we normally say in the first 3 to 6 months, if your period changes, don't worry about it because it tends to settle down after the first 3 to 6 months. And again, this is highly effective if it is taken as prescribed, which is at the same time every day.
So do they have like age bracket of women that can take this or any?
We are happy for women to take the progesterone only pill up to, I want to say, 55 years.
Mm.
But if they've not if they are not having any period with it, I think after 50 we can check their hormone levels, and if they've gone into menopause, we just tell them to use it for 1 more year and then they can stop. So it's relatively safe.
Okay.
So we're happy for ladies to carry on with the progesterone only pill.
Just
In the next one is injections. The
mm.
injections, the one we use
Injection.
in the UK, there are two types. The one we use in the UK is the 3 monthly one. So every 12 weeks, the lady will go to her nurse or at her GP practice or her GP and have an injection in her muscle, a deep injection into her muscle, usually around her buttock or her,
Mm.
and then that stops her from falling pregnant. And then she just goes once every 3 months. It's very effective. Again, more than 99% effective. Um,
99%. That means
yeah,
it's
it
really
can
effective.
stop people from bleeding. Some people don't have periods. Some people might have irregular periods, or prolonged periods. Again, especially initially. In terms of the side effects, same as the progesterone only pill. So some people can get mood swings, acne, bloating, and all of that. But when people ask about weight gain, the injection is
Mm.
the only one that actually has the evidence that it can cause weight gain.
With Kim.
So if a
Okay.
lady comes to me and say the one thing I wish to avoid is weight gain, then that lady is not for the injection. So some people may not gain weight on it, but that's the one most likely to cause weight
Mm.
gain. Yeah.
With Kim. And
That,
that's the fear of most women. You see,
mm,
why information and knowledge is very important.
mhm.
Yeah. Mm.
It can also cause reduced bone density, and that's why we tend to avoid it in teenagers when their
Mm.
bones are still forming. Then, as I said, all the usual progesterone side effects. The other thing I was going to say, it can stop the periods as well. So this is a good way for people that don't want periods if they are struggling with
Mm.
heavy periods. For a lady that's going to try for a baby, let's say in a year's time, we would not advise the injection because of all the methods, this is the only methods that again has evidence of it can cause delay in return to fertility of
Mm.
up to a year. Unlike the other methods, when you stop them, we say that you become fertile immediately, like your fertility goes back to what it was. So if
No
you were
more. Okay.
yeah, it goes back to the baseline. If the person was fertile anyway, they'll still be fertile. If they already had fertility issues, that will not be changed. So most of the methods, when you stop them, fertility kind of returns to baseline for the lady.
Okay.
Yeah. And then as I said, it's highly effective, and if it's taken every 12 to 13 weeks, then it's most people won't fall pregnant.
Okay.
Then we've got the implants.
Implants.
Implants is a tiny rod like this, just like a matchstick, just as thin
Mm.
as this, just like this, about 4 centimeter in length. Again, as I said, it's just like a matchstick, and it sits in the upper arm. So it sits there, around there,
Mm.
and nobody can see it, but the woman can feel it, so she can feel it and know that it's there. And once it's put in, it stays for 3 years. The one we use in the UK, I think there's another one that stays for 5 years that's used in certain parts of the world. So your healthcare provider will tell you how long it will stay in for. This is fantastic because once it's in for 3 years, the lady does not
You
have to
can't take it.
remember. No need for
Mm.
daily tablets, no need for visit to the doctors for injection. It stays there. It's highly effective. It's about, I think, failure rate is like 1 in 1,000 or 1 in 2,000. So it's extremely effective, over 99% effective.
So can you wake up anytime to say I want to take it off?
Yes. So
Okay.
if a lady says, well, I've had my child, I don't want to have another child for the next 2 years, she can go and put it in. When it's 2 years and she wants to try for another baby, she starts taking folic acid and vitamin D tablets 3 months before, because once we take this out, she can fall pregnant the next month.
Mm.
If that's her baseline fertility. So if her
Mm.
baseline fertility was going to be that she will fall pregnant, basically the hormone is out of her system within a couple of days. So she goes back to what her usual fertility and hormonal levels. In terms of side effects, some people's period stops completely. Some ladies like it. Some ladies worry about this
Like
fantastic
forever,
woman
is that what
issue.
you mean?
No, just for when they're
Okay.
on it. When they take
Okay.
it out,
Okay.
they'll get their
Okay.
period
Okay.
again.
Uh,
So people may also get the progesterone side effects that I mentioned earlier. Again,
mm,
just with acne may be a bit worse. They may get headaches, mood swings, a bit of bloating, breast tenderness. Most of my patients don't necessarily say that. So
oh.
I'm not entirely sure how common it is. In terms of what's more common though, some women get irregular period, and that's
Mm,
probably one of the most common side effects that I've seen, where people that would make people to stop it. But in the first 3 to 6 months, again, we just say wait, because sometimes after 6 months it settles completely.
yeah, which is good.
And in terms of the risk, it's just that you might have a bit of a scar there once it's taken out. And when I mean a scar, I mean like a 1 to 2 millimeter scar, that unless you were
Mm,
literally trying to show somebody, you know,
no
it's
one will notice it.
they might not see it. So is it just a tiny scar? Obviously, taking it out and putting it in a little bit of not surgery, but maybe like a 5-10 minute procedure. And there's a very, very small chance that it can migrate away from there. But if the one we use in the UK, you can find it by X-ray. So if it does migrate, it can be found. I've not seen this in real life, but it's a risk that we say. Again, most women are it's not contraindicated in most women, so most women can have it. I think again the only contraindication that I remember off the top of my head is if they've got cancer. And as
Mm.
I said, it's highly effective. And then we go to the coils. I know you're really wanting to know about the coils. There are two types of coils. The coil
Okay.
is really small. It's a shame that I can't share my slides, because I was just going to
Mm.
show some pictures of all these methods. But basically, the coil is, if you see the palm of my hand,
Yeah, I can
uh,
see it.
the coil is just, it sits there like that. It's small. It's not big at all. It's really small, just
Mm.
like a T-shaped thing. If you Google it, you'll
Okay.
see it. And there are two types of coil. You've got the copper coil, and you've got the not Myrina, hormonal coil. Myrina is just a brand. You've got the hormonal coil. The copper coil, let's talk about that one first. Copper coil is good
Uh,
for women that say, I don't want any hormones. I just want not something that does not have hormones. If a lady is more than 40 and she has a copper coil fitted, she can have that till the end of her reproductive life. She doesn't need to change it, and that will give her more than 99% protection against pregnancies. And she will have a monthly period for those that want monthly periods. So that's very natural in a way, yeah? So it sits in the womb. It creates a sterile environment that where the that's not really conducive for ovulation or implantation. So even if ovulation takes place, it will not implant. And as I said, the woman will continue to get her period just like she would without the period, without the coil. So if she was someone that was very regular, banged or every month she'll have a period, then that will stay the same. If she was the type of person that doesn't get a period every month, then
it will still
whatever
be
it
the same.
was,
Yeah.
yes, it remains. It doesn't change her cycle. What it does change though is her periods may not will always, but it's her period may become heavier, may become more crampy, or may become slightly prolonged. So if someone comes to me with painful or heavy periods, I won't be recommending this for them.
Mm.
So but for some women, that if you ask them, are your periods heavy, they say no, actually my periods are absolutely fine, just 2 days of light period, then this is fine.
Mm.
um the evidence is that after 3 to 6 months, the heaviness and flow can reduce, but overall, it is the one method that can make periods heavy and a bit more painful. Okay. If a woman is not up to 40 and we have it fitted, we usually say, well, there are different types. There are different types, and they generally last between 5 to 10 years. But the copper 380, which is the one we use most commonly, is the 10-year one. But there are other ones that are slightly smaller than that last a shorter time. So again, your healthcare provider will tell you exactly which one and when you need to come back to have it changed. There's a 1 in 20 chance that it will fall out. So we ask
Yeah,
women,
the 1 in
especially,
20. Wow, that means it really
sorry.
falls. I say 1 in 20. That means it falls.
Yes, it can fall out. So generally, we teach women to feel for their threads in their vagina so that they know that it's still there. And usually, we say that they should check after every period. And there's a small chance that actually it can perforate. So perforate sounds, it can kind of bury itself within the wall of the uterus rather than just sitting in the cavity. And if that
Mm,
happens, we can find it with it can be taken out with keyhole surgery.
mm. So
uh,
how will a woman know it's falling off?
if you can't feel your thread, then you must go and
Mm,
speak to a healthcare provider, and they would examine and check for the threads. And if they can't find it, they
mm,
would ask for an ultrasound to locate the coil. And if they sometimes it has displaced itself, or sometimes it's perfectly fine, it's just that the threads have gone up into the cervix.
And also, what could make it fall off?
Good question.
Yeah.
So obviously it's a foreign body, and our bodies are very clever. So sometimes the womb just cramps and it comes out.
Mm,
Sometimes if it was fitted a bit lower down, it can fall out. If the woman is breastfeeding, the chances of it falling out is higher, because when you breastfeed, your womb contracts, so it can push it
mm,
out. So we
mm,
tell women to check the threads. Again, because no contraception is 100% effective, if a woman has pregnancy symptoms with any method, she should go and do a test. Because if you have a coil, this copper coil, I told you it will not stop your period, yeah? Because it doesn't have hormones. If a woman on a copper coil that does not have hormones, if she misses her period, then she has to respond exactly the same way as a woman without a coil. She needs to go and do a test. And if that test is positive, then she must go and see a doctor the same day or the next day, because the chances of it being an ectopic is higher if you have a coil.
mm.
Yeah.
So it can be risky then.
I don't know if that's the right word, because I'm not sure what's more risky. Having an unwanted pregnancy is risky. If a 48-year-old lady gets pregnant, that's risky, isn't it? So it depends on which risk people are happy to live with.
Mm,
Do people prefer to, if you're married and you have, it's not, well, you're married and you have, your husband as a lady, and you say, no, we can only have sex for 2 weeks in a month because I'm afraid of pregnancy. And then when you're having sex, you can't even relax because you are panicking in case something happens.
cautious.
Then, and then that's a very long term thing, isn't it? Is it
Mm,
really, versus have a coil that has maybe 1 in 100, 1 in 1,000 chance of XYZ? Which chances? It depends what people are comfortable with at the end of the day,
yeah,
isn't it?
yeah, yeah. And what
But
one work? Yeah.
yeah, so let me talk about the last one, which is probably one of my favorites. Okay,
Mm.
is the
And because of time too.
is the hormonal coil.
Okay, hormonal call.
The hormonal coil is highly effective and is used to treat heavy or painful periods. It's actually the gold standard treatment for heavy periods. It can
Mm,
last up to 8 years for contraception. It can be used as
mm,
half of HRT for women that want hormones for their menopause when they're having very severe symptoms. It can stop people's periods. So this is very popular with gynecologists. If a woman goes in with heavy bleeding, you are likely to be recommended a coil, a hormonal coil. And the most common one we use in the UK is the Mirena. There are other coils, and they're very equally effective ones as well, like Levoset, Benelexa, and other coils. The risk of perforation and ectopic pregnancy is similar to the copper coil, but this Mirena, the hormonal coil, has is very much used for other things apart from preventing pregnancy, like managing heavy periods and painful periods and all of that. Yeah, and then emergency contraception. Two lines. So emergency contraception is should not be used regularly because it wasn't meant to be that way. There's a high failure rate. It's only effective if used on time. The earlier the better. One of them you can only use it within 72 hours. Even then, it's not a guarantee that the person will not fall pregnant. It's about 80% effective. That's Lemonel. Then the other one is Ella 1, ulipristal acetate, which can be used up to 5 days. Again, the earlier the better. Some can only be used by certain class of people, like people with severe asthma. Some you have to double the dose if you're overweight. But the most effective emergency contraception is the copper coil. So the non-hormonal coil can also be inserted if someone has had intercourse and they come to a provider within 5 days. They can put it in and it can stop any, even if the egg
Mm,
has already fertilized, it can stop it
mm,
from planting. So actually it can be used as emergency contraception, and the benefit of that is that they can leave it in so that the person then has it for their ongoing contraception.
yeah. Wow. It looks like there's a whole lot.
There's a
A
whole
whole
lot.
lot.
It's
Yeah.
better for people to, I think that's just an overview. It's better for people to actually go to their provider and speak to them and see what works for them.
Mm, yeah. And for all the types of contraceptive that you talked about, I think I noticed something in common with like the acne, the mood swing, and all of that, that women experience. So what can they do to manage those feelings at that point? What can they do?
It depends. So, are you talking about when they have the home
Yeah, when
or
they have the call, yeah, you mentioned like some of the side effects, they start feeling, this mood swing and all of that. So what can they do to manage it at that point?
it depends because if it's mild and if it's not
Mm,
really an issue, then it's fine. But if it's severe, then some people will opt to stop that method.
okay.
Yeah, but the
Okay.
thing I always say to women is that you can never judge how your body is going to respond based on how your sister's body or your friend's body responded. So I
Mm,
would never say don't have this because you heard bad things about it, because unless you try the method, you don't actually know how it's going to work for you. And no two people are the same.
mm, yeah. Yeah, and also one thing I picked again from all of this is, like you said, no two people are the same. Know what works for you. Don't say because my friend had it, like the one you mentioned that makes people put on weight. So people must, someone else must have had it, and then he gained weight, and then because of that, because I know that's a fear, that's major fear for most women, including me. Like I don't want to put on weight. I don't want to put on weight. So there's this fear of I don't want to put on weight without knowing that there are still other options that you can have that will make you not to put on weight that you're trying to avoid. So I think that's one of the take home for me. That's there are many options. So you need to know what works for you, and you need to speak to your medical advisor or medical professional to sit you down to explain all of this in details and then help you make informed choice that
Yes.
best suits your body and
Yes.
what you want. Yeah, I think that is my take home from everything you've explained. So
Yeah.
thank
So
you so much.
if you go to a sexual health clinic or to the
Mhm.
GP or even some pharmacies, even online pharmacies would do like a consultation online and
Mm,
issue some contraception. So it's very readily available. That's why I get a bit twitch when I see women, they say, "Oh, I felt pregnant," and then they are crying and then feeling
mm,
really awful. And I'm thinking, well, just use some contraception and let your mind be at rest rather
mm.
than having that fear all the time.
Yeah, yeah. And then that peace of mind too, yes. Also, do you have time to take few questions? I know we're really, yeah. Okay. Thank you so much. Okay. So let's see. Thank you so much for your time and thank you for breaking it down for us. Um, so the first one we have here is, let's see, where is it? What are the various forms of contraceptions available as an, I think you talked about it, isn't it? Yeah. Okay. So let's keep that one then. So what will the pain make me put? Okay, we also addressed that already. Do I need to take pill every day? I think you also addressed it. Depend on what's the option you're going for, isn't it? Yeah.
Yeah, so
So,
most of the contraceptive pills you need to take
mm,
every day. The only difference is that with the combined pill, you might have a break for a couple of days and it says it
mm,
on the pack, or you agree with your doctor how you are going to take it. With the progesterone only pill, which we call the mini pill, you have to
mm,
ideally take that the same time every single day without stop.
okay. And also, what is the percentage that I will not get pregnant with the pills? Because I have seen and heard people get pregnant even with the pill. Yes, I think actually I've heard so as well.
I think
So
I
what?
said that. So
Mm,
with use, like the way we wrote it down on paper, if you take it like that the same time every single day without fail,
mm,
how it is used, given, then the effectiveness is up to 98 to 99%.
I see.
But the
Yeah.
way most people use it with typical use, then it's about maybe up to 90%, something like that.
Mm. So the issue now is on individual not taking it as they ought to or as they should. Okay. So that's
And
where.
that, apart from how they take it, if you have diarrhea, the pill can actually come out of your gut. So you might not, you might, or so, or if you vomit, or if you
Mm,
take it, the timing not being as it is, or if you miss a pill, like it's very.
mm,
Imagine taking a pill 365 days. I'm sure most women will miss it here, a pill here and there, isn't it? So if
human
they miss a
factor.
pill here and there, then the chances of falling pregnant is high. Like the mini pill, if you miss even one tablet, because usually they have 3 to 12 hours window. If you miss
Mm,
even one tablet, you can fall pregnant. And then with the combined pill, depending on the timing of the cycle, if you miss it in the first week after your break, you can fall pregnant very easily.
mm. So meaning some of these women that cry, so even with all the pills, I see, meaning they would have done something wrong somewhere that I
It's
see.
possible. It's
Yes.
possible. Sometimes even medication that people may take or
Mm,
herbs can actually affect the pill and stop it from working well.
without them even knowing. Yes. Yeah. So how long after having unprotected sex can the emergency pill be taken?
Yeah, I said that it's between 3 and 5 days, depending
Three
on
and
which
five
type.
days. Mm. And what would be your advice on withdrawal? There are still some people that are still very, should I say, adamant, like even with all of this knowledge, information, they still don't want to take any, they still want to carry on with their withdrawal method and all that. So what will happen to such people? What advice will you give to them in regards to getting pregnant and not getting pregnant and enjoying sex as well?
At the end of the day, we are all individuals with free will. So if
Yeah.
that's their method, then that's fine. They should just make sure that they use it consistently, and reliably, but be aware that they are taking that risk of falling pregnant. And if they fall pregnant, that's the risk that they've chosen to take. Yeah, but there are people that just say for whatever reason that they're not going to use any contraception. As long as they're
Mm.
disciplined enough and the man and the woman are on board. I think it's hard though. So I've seen a lot of people unfortunately fall pregnant unplanned.
Yeah, a lot, a
Yeah,
lot.
a lot. And it can be a bit, they can feel very upset about it. And a lot of people end up going to have abortions, even as married people.
Yeah,
That's extremely common.
openly and secretly.
A lot, because here in the UK, you can actually have an abortion legally. So
Yeah.
it's not, a lot of people terminate the pregnancy, but personally, I don't feel like that's something that anybody should have to deal with. I'm not saying that contraception is 100% effective, but they are very reliable forms. And I feel like if a woman have taken, or a man have taken the steps to have contraception and they still fall pregnant, at least for me, they've already done what they could do, isn't it? It's slightly
Yeah.
different. That's how I feel.
And then
Some
there
people.
is that satisfaction of conscience that you even try, you made an effort. Yes.
Yes. Some people, for whatever reason, different contraceptives may not suit them. So I know people that say I've tried 5 different forms and it didn't suit me.
Mm,
And in those very rare cases, it may just be that they rely on condoms and other natural methods. Or
okay.
their
Thank you
male
for
partner
that.
can have, as I said, vasectomy is more effective actually than the female sterilization. So
Oh,
really, our ladies should be talking to the men as well to sort something out.
And I think this is, should I say, like a stereotype that when it comes to contraception, contrast is like a female thing, women thing, not because when you even mention it, you're like, so men to do, it kind of sounded strange to me. So I think we need to start creating that awareness for men as well. They should still do something to help us because it shouldn't be everything about us, about us. So
Yeah.
I really like that. And also, I heard people lose, yeah, I heard people lose their hair after birth control. How true is it?
So I think I've heard someone mention this to me. I think it's probably around the hormonal changes. So some people lose their hair when they are pregnant or after they have their baby. Those are just hormonal things, really.
Mm,
I'm not, what I'll probably say is if a method causes a woman to lose a lot of hair and is distressing to her and it's not something that she wants to put up with, then she can change because she might find
mm,
another method that will not cause that at all. So I know a lot of women who wish to avoid hormones who we end up putting a copper coil for because that's the hormone free option and it's highly effective and they can have it in for, as I said, 10 years and or more.
mm. And then, which contraceptive do you think, do they really have, like, say this is the best? I know you have indirectly answered it.
No,
So
it depends on
yeah,
the lady.
yeah, on your body and
Yeah.
what you want. Yes.
Yes. Yes.
Okay. I am postpartum and want to start contraception. When do you think is the best time?
It depends. It depends. So if a lady is not, if she's breastfeeding
Mm,
without using giving the baby anything else, not fully breastfeeding, and she has
mm.
not yet had a period and her baby is less than 6 months, then actually 9 times out of 10 she's not going to fall pregnant anyway.
Can I share my personal experience? So when I had my daughter, I breastfed her, I did 6 months exclusive. So and then I was not menstruating. In fact, I breastfed her for 22 months. And for that 22 months, I did not menstruate. When I got pregnant for my son, I didn't even know that I was pregnant until I started noticing, feeling feverish. I was putting on weight, eating and all of that. And then my tummy was getting big. So I was like, oh, something must be wrong. Let me go for checkup and see what's going on. So that was when I was referred to scan and then scan so that it was pregnancy. So what could have happened there?
So how many
Because
months
I did exclusive for her as well. So what's
was your baby less than 6 months when you fell pregnant?
no, it was after.
Yes, I said if the baby is less than 6 months.
It's
After
less,
6 months, you
yeah.
can't rely on lactational amenorrhea. Whether you've not had a period or not, after 6 months, then you can't rely on that method. If Because usually your baby will start eating something else from 6 months.
Mm,
They'll start
mm,
weaning. So you are no
yeah.
longer exclusively breastfeeding. You are now,
Mm,
topping up basically with breast milk.
mm,
That's different. That
mm.
doesn't offer you the same protection.
So it's just for that first 6 months that you are like sick. Like, are you sure? Is that one? Can you guarantee like 100% security for that one? No.
No. No, no. I think it's in the region of maybe around 90 to 99, not 100%, no.
Which is
Now,
still.
in terms of when a woman can have contraceptive, it depends on what kind of birth she had as well. Some
Mm,
women, if they are wanting to be sterilized, you can actually request to be sterilized during a CS, for instance. So if you're having a planned CS and it's your last
mm,
baby, they can tie
mm,
your tubes during the procedure. In fact, that's actually quite good because that means that you don't need two procedures.
mm.
And then the coil cannot be fitted very, I think up to 4 weeks after you've someone has had a baby. And then for most methods like the implants, you can have it up to the implants, and the progesterone pill can be started 3 weeks after. And
After you had your baby.
yes, but the combined pill, if the baby is less than 6 weeks, usually we don't necessarily advise the combined pill because of increased risk of blood clots. But if the baby
Mm,
is more than 6 weeks, if they are breastfeeding, combined pill, I think, can interact with breast milk supply. So it just depends. Again, this is why you need to go to your doctor and have those
mm,
conversations. And we have something called the UK MEC that we look at. It's a summary table. and we can check 99% of the conditions there and check it against the method you want to know whether the benefit outweighs the risk or the risk outweighs the benefit. So your GP will be able to do that for you, or in a
Mm.
sexual health clinic.
Okay, thank you. And I am post. Okay, yeah, we've talked about that. Any side effects to, and I think you've talked about the side effects. So, and then the last one, at what age can I stop using contraception, and for how long can I even use it? Are we going to use it forever? And
So with some of the methods, so with the combined pill, I think you can use it up to once, depending on the method. With the
Mm,
progesterone pill and any progesterone method and the coils and implants, injection, coil and implants, usually you can use that even up to 55. Some of the methods we stop wanting to prescribe around 50 pill. But again, if a lady is overweight or if she's smoking, she might not be able to use the combined pill, even at less than 35. And in terms of how long you're using, it doesn't, we are not aware of any like duration of use that's problematic. So people can be on the pill for 20 years or 15 years or 25 years. There's no such thing as, oh, let me give my body a break. There's no evidence that it's causing any real damage. Having said that, things like the combined pill can increase the risk of breast cancer, but the progesterone pill, as far as we're aware at the moment, we don't have that evidence that increases people's risk of cancer. So there's no kind
wow.
of hard and fast rule, but most
Mm,
in the UK, we say that the average age of menopause is around 53 years. So
mm,
usually, if you are 55 years, we can stop most contraceptive,
yeah,
because
and
the chances of somebody having it is only a miracle baby that will be born after 55 years. 55 years, we essentially say that the chances of you falling pregnant are extremely low.
yeah. Okay. So around that age, you can just advise yourself or still seek advice and take it off.
Yes. So if we put a coil in, usually we'll be taking it out at 55. If we put an implant, implant is still three years, isn't it? We take it out at 55. At 55,
Mm,
usually we stop all those contraceptive methods, because most women have gone through the change, and they're not going to fall pregnant.
mm,
If a woman over 50, so if a woman is not on any contraception and she's not had a period for more than 12 months, then we'll probably say she's gone through the menopause and she needs to go and see the doctor. So some people can even go through the menopause early,
mm,
before 40 45, and that will say if they are less than 40, we'll say they have something called premature ovarian failure. So people can have early menopause.
mm.
So if a woman has missed her period really for 3 to 6 months and she's not on any contraceptive and she's not pregnant, you should go and see a doctor so that they can investigate it.
Okay. So is there any I was gonna ask, so say someone had it and then it's getting around to that menopause age. Is there like do you send like a reminder or message or something? Because some people might actually forget that they've had it. Imagine something that someone had maybe like at 28, 30, and then all the way down till they are like 50 something. They might actually forget. So do you like do like a chase up to come and remove it, or how do you do it if the person
Well,
did not remember?
we do put a diary date, but it depends on depends on the practice. We can put a diary date, but we give women a little card which they can put in their wallets with the date when it will be removed. And don't forget, I said, if a woman is under 45, chances are that she's going to be having that changed anyway. Is if we put it over 45, if it's the
Mm,
hormonal coil, then she can leave it till menopause. But for the copper coil from 40, she can leave it till menopause. So you're talking about 10, 12 years, 13 years, something like that. So
mm,
generally, we say people should have their little card. Most people don't forget that, because you can feel
mm,
the strings if you put your hand into your vagina as well. So many people don't forget, but it will be on the GP record. So even if they just remember one day out of all these many years, they can ask the GP surgery to check, and it will be on their system. But we do put a diary date. I don't know whether that's everybody though around the UK.
So
I'm
you
not.
don't do like a phone call or like a text message, like when you have hospital appointment, they send like a reminder few days to and all of that. Do
Yeah,
they
if
you do?
this if the surgery puts a diary date, then they will
Mm,
call the people and tell them that they are due for a change. But
okay.
generally, we advise women to remember.
You remember for yourself.
Remember. Yeah. Oh, I
Oh,
was
that
going to say something. There was a statement I
okay.
made earlier that I don't want people to misconstrue. Now,
Mm,
if you are not taking any hormone and you have not had a period for more than, ideally, if you are not on any hormone, ideally you should have about 4 periods a year. If you are not approaching menopause, your body needs to shed that uterus, so and that uterine lining, so that it doesn't build up too much. Yeah, because that can increase the risk of endometrial cancer. So if a lady has polycystic ovaries, for instance, and she bleeds 2 times a year, there's an increased risk of endometrial cancer because the womb is just building and building and building and it's not shedding. But if she has a coil, then that lining is not going to build and build and build. So it will reduce that risk.
risk.
But if she doesn't have any hormone and she's not approaching menopause and she just has not had a period, let's say a 30-year-old woman or a 35-year-old woman had not had a period for more than 3 months and she's not pregnant, she's not on hormones, then she should go
Mm.
and see a doctor so that
I
they
mean,
can
something is
do.
not right here.
Something may be wrong.
Mm.
It could just be her hormones, or it could even be something as serious as a brain issue that can cause that.
Mm. I know of a relation that doesn't see her period regularly, just once in a while. And I know she's visited hospital, so I don't know,
Yeah,
you know.
people would
Mm.
they will be investigated, and if there is no clear cause, then they can advise them on what to do.
Yeah,
So
I
for
think,
some,
sorry. Yeah, I think for her case, they said it was normal. There was nothing wrong with her. Yes, because I knew she went to several hospitals and they said it was normal.
for people that have polycystic ovaries, they can have irregular periods. They might bleed 3 times a year, 2 times a year. If they are bleeding less than every 3 months, we might actually induce a period because they are not, that womb is just, as I said, building up and building up and building up the lining without shedding. So we might induce them to have a bleed.
Mm. There's a whole lot to digest in this in this topic, and it's such a broad. You just need to understand it and know what works for you. So thank you so much. Really appreciate you. Thank you for the extra time. We appreciate you. Thank you for doing this with us. And we celebrate you. We really appreciate everything you shared for pouring your heart to us. We are grateful. Thank you so much. Thank you for your time.
Thank you.
Thank you, and may God bless you.
Thank you.
And we hope to bring you back again because it's very interesting, and I think we need to be reminding ourselves of this contraception all the time, especially and now creating awareness for men as well. So I think we really need to bring you back again, soon.
If people ask their questions, if you have a way for people to ask their questions, then I think that would be really useful to know exactly what people would like to know, and then we can just do Q&A because trying to summarize all of contraception
Mm,
in just a couple
it's
of
a lot.
minutes of
Yeah.
that without knowing what people really have questions about. I do like the questions you've asked, and it sounds like you've asked most of the questions, but there might just be
Mm,
someone out there that has another question. So feel free
mhm.
to write it and send it to Dumebi.
Okay. Thank you so much. Thank you
Thank you.
for your time. We appreciate you and we hope you have a very good evening. Thank you and hope to see you again, Thank you.
Thank
Thank
you
you.
very much.
Yeah. So I hope we've all learned one or two things. What is your take home? If you learn one thing, want anything, what is your take home? What's without be? For me, my take home is when it comes to contraception and contraceptive is very broad. Is something that you need to really understand for yourself, and it's not something you just need to wake up or hear from your friend or someone else and just make decision with that. No, you need to seek professional advice or a health sex ad from sex specialists to for them to tell you the right choice to make based on your what you want and based on your body as well. You don't just need to say your friend put on weight, or they told you, even when I have it, I still put on weight. You don't need to run with that. It has to be, yourself, what your body needs, and what works for you, because different thing works for different people. So you need to know what works for you. And there's different types. She named a lot of them. So you need to understand all of this so you'll be able to know what works for you and what you really want and what your body wants. So I think for me, that is my take home. And all of us that are someone like me, and I know if you are still in that category that you don't want to put on weight, trust me, there are other options for you. All of them does not make you put on weight. There are also other options that when you have it, it won't make you put on weight. It will still make you, look the way you want. So it's just you knowing what you want and what works for you, really. I think that is my take home on this. And so if you have any question, you can always send it to me, and then she's very happy to still answer your question any day, anytime. So thank you as we begin to come to the end of this live session. I hope you've learned something. I have learned something. Can I see your question, your take home in the live session? Any take home, anything? Yes, we can hear you. Hi, Dumebi. Okay. Any, what's your take home? What did you learn? What are you going to do differently? What are you going to start doing? And for the men, we have good news to you that men too can be on contraceptive as well. It's not only about women. When we say contraception, it's not just a women thing, it's also for men. Men to have their own. It's still knowing what you need to do. And the emergency one too, I never heard of that, emergency contraceptive. So they still have all of that. So it's just knowing the best option for you. Contraception, contraceptive, everything about contraceptive. So we're going to call it a day now. So thank you so much. And we hope to see you all again same time next week. I think we have another live session next week, Friday. So I hope to see you all again. Thank you for doing this with me. All right. Bye bye. And thank you so much. Thank you. Yeah.